Okay, now we're going to look at Chapter 5, and Chapter 5 focuses on the cultural aspects of psychiatric mental health nursing. You guys have had a lot of cultural classes and information in the past, so this should be pretty much a review with kind of that psychiatric spin on it. So, the importance of culturally relevant care. Of course, we know what culture is. They share beliefs, values, and practices. Their thinking and behavior are kind of influenced all the same. There are some different cultural norms, what's normal in the culture and abnormal within a culture. And then ethnic groups is different from culture, but ethnic groups have a common heritage and history and do typically kind of share a worldview for thinking. So the next three slides kind of break up Western tradition, Eastern tradition, and Indigenous tradition. And this is broken down for you guys a little bit more easily to see, I think, on table 5-2 on page 86. We're pretty familiar with Western tradition for the most part. We do find our identity in our own individualism, the way we are, the way we function. We value autonomy, being able to take care of ourselves, being able to rely on ourselves. We look at the mind in Western tradition. I'm saying we because I've grown up Western tradition. We look at the differences between mind and body, two separate things. And we usually view disease as having a cause, and we treat it based off of that cause. Time is linear. We expect people to show up on time. We're very time driven. And if we are going to view ourselves as successful, we are able to take care of ourselves in the future. We don't have worry of the future. Eastern tradition is very different than Western tradition. They really look at their family as a basis for their identity. It's always the starting point, and it continues on through life. They view mind, body, spirit as one entity, and time is very circular and recurring, and very flexible. They are born into fate, and they have a duty to comply not to only what their fate is, but also to what their family requires of them. And disease is usually caused by a lack of balance and energy forces. Sometimes they look at the yin and the yang, the hot and the cold, dietary problems, those types of things. So their ethics of care is based on promoting positive relationships. They have a lot of value with compassion, discernment, and those types of things. So it's very different than what I've grown up in Western culture, but we can find a lot of values in Eastern tradition that we can help meet specific needs for those people and that culture. Indigenous culture, they place a lot of significance on human and the natural world. Their sense of real is multidimensional, and reality does transcends time and space. So usually their identity is on the tribe. Sometimes you can view that as a family, but it really is community for their entire ethnic group or their tribe. The self does not really exist except for in relationships with one another's. So typically their view of disease is a lack of personal, interpersonal, environmental, or even spiritual harmony. Their thoughts and words tend to shape their reality, and evil spirits do exist. So their ethics of community are based on the needs of the community. It's never individualistic. It's never about themselves or your rights. And value in these types of cultures are given to the contribution that they make to their community or to their tribe. Culture and mental health. The term enculturation or enculturation is the culture's worldview, beliefs, values, and practices are transmitted into its members through this process. So typically an example of this is we learn what's right and wrong from our parents, and then as we grow up, we are able to make those free choices, but we typically kind of stick to what we've been taught. A deviance from cultural expectations can be defined as illness by other members in that group, especially when you're looking at Eastern and other types of cultures, not Western. Ethnocentrism looks at your culture being better than others. And so that can pose quite a problem when you're trying to be culturally competent and culturally sound as a mental health nurse. So there are some very significant barriers to the quality of mental health services. First and foremost, communication barriers. If you're not speaking the same language as your patient, that's going to be very difficult. We do need to get an interpreter, and this interpreter cannot be a relative or a friend. The interpreter, it would be preferred that they are same gender, age, social status, and religion. That way they can interpret things much better for you, even the nonverbal communication. The stigma of mental illness. We know in our Western society or Western culture that the stigma is pretty strong. Usually people will think that if they have a mental illness, they will kind of associate that with just overall weakness, that they're a weak person. And they will also view that other people may have biases towards them. The stigma of mental illness in other cultures actually tends to be even more severe than in Western culture, so that's important to remember. Misdiagnosis. We do have some very specific culture-bound syndromes. These are listed for you in box 5-2 that are very specific to different cultures and can be misdiagnosed as mental illness, and they are not. Also, genetic variations in pharmacodynamics, and I think you guys are familiar with pharmacodynamics and how medications work differently in different genetic groups. So we do have to keep that in mind. There are 3 groups that our book points out are at risk for mental illness and also inadequate care, so kind of a double problem there. The first group is immigrants, moving from a completely different culture into a new culture and finding difficulty in finding that care. Refugees are a different type of immigrant. Usually they come from an intolerable culture, one where maybe they're forced into certain living conditions, and so they kind of have that traumatic past coupled with a new culture that they're trying to integrate into. So I can definitely see where that inadequate care and that bigger risk of mental illness could come into play with our refugees that we are seeing. And then just overall cultural minorities. We can look at ethnic background as being a minority, but we could also look at cultural minorities as people who live in poverty. They are 2 to 3 times more likely to develop mental illness, and so we do need to keep those other types of minorities in mind. So the next few slides are going to focus on how are we as psychiatric nurses going to display cultural competency for our patients. So it's kind of a 5-fold awareness type of model here. So the first one is cultural awareness. This is looking at your own culture, your own biases, recognizing certain things that, certain feelings that appear during interactions with people, and also being able to look on how you were raised and maybe how you have similarities with your culture that you grew up in, but maybe some differences there too. It's also important to recognize the 3 different cultures that are intersecting when you're caring for patients in the hospital or in an outpatient setting. So the culture of the patient, along with your own culture, and then the culture of the setting that you're in, all playing a role within that encounter. The next one is cultural knowledge, and this is how we gain information about other cultures. Obviously, you can learn this by attending cultural events and programs. You can learn it by studying on your own. Also, forging friendships with other diverse cultural groups. The one that I think is most important with nursing is developing a good rapport with your patient and asking culturally relevant questions. It'll be difficult for us to know anything about our patient's culture if we're not willing to ask questions and also be willing to listen to those answers. Different cultural encounters will help deter the nurse from stereotyping. I think we're all pretty attuned to what stereotyping is. It does help us gain confidence in those interactions that we may have in the future. And it does help to reduce or avoid some of those instances where we may say something culturally inappropriate. So cultural skill ability is always growing within the nurse. From the very beginning, I don't think you ever become completely culturally competent because we can't know every aspect of the culture that we are working with. So we do have to learn, though, how to perform a cultural assessment in a sensitive way. And if you turn to page 94, there are some very specific questions that you can ask when doing an assessment that help you to be culturally competent and not make assumptions about your patient. So the goal, though, at the end of this assessment, of course, is to be culturally competent enough to mutually agree upon a therapeutic plan for your patient. Something that's culturally acceptable for your patient and also acceptable scientific-wise for their care in that unit. And we want to see those positive outcomes from this interaction. So we have Miss B who's admitted to your unit. In your assessment, you identify some cultural patterns that may support or may interfere with the health and recovery process. So what are some things that we can do to identify and deal with some of these cultural patterns? So our book suggests that practices that are neither helpful nor harmful, we can accommodate for. We can negotiate some of those in if they're going to encourage our patient to stick to the plan of care. But if we do determine that patterns are harmful, we do need to take some attempts to repattern or restructure those, or maybe just educate our patient. Our book gives a good example of a patient maybe taking an herb that interferes with a prescription medication. They probably aren't aware of that. Now, that may require a couple of things on our part. We may be able to teach them enough that they're willing to stop taking that herb, or we may need to change their medication regimen if that's possible to accommodate for that. The last thing that I think is probably one of the most important things within this five-fold criteria here is the cultural desire. We want to have genuine concern for our patient's well-being and a willingness to listen to their point of view and be sure that they are understood. It is important to have patience and consideration and empathy when talking to someone about their specific culture and how that relates to their mental health. So if we have a desire to be culturally competent, this is going to be one of the best steps that we can take for our patient. So which worldview would the nurse anticipate from a client who says, it's important to save enough money to take care of yourself in your old age? We should not rely on anyone else to take care of us. So this is obviously going to go back to the culture that is very individualistic, that is very self-sufficient by nature. Within that culture, and that's going to be our Western or our science worldview. Eastern focuses very much on the family. So as you get older, they would rely on the younger parts of the family to care for them. And then our harmony worldview is going to look at that community. So not just the family unit, but even outside of that. Which term refers to individuals' belief that their culture, values, and practices are correct and superior to those of others? And so all four of these are pretty significant terms that you do need to know. Assimilation, or becoming part of a culture. Enculturation, also kind of similar to assimilation. Ethnocentrism, meaning your ethnic background is central and it's usually the best. And somatization are those physical symptoms that patients have related to mental illness or mental symptoms. So the correct answer here is C. Now, if you have any questions at all about Chapter 5, please send me those questions before our next exam.